like to start by acknowledging the Gadigal people of the Eora Nation, the traditional custodians of the lands I'm speaking to you from today. I'd like to acknowledge traditional custodians across the lands where all of you are joining us as well. I'd like to pay respects to elders past, present and emerging, and acknowledge that sovereignty has never been ceded. Thank you all for tuning in today. I'm so excited today to be chatting to the winners of the New South Wales Mental Health Commissioner's Community Champion Award. Don't forget, you can hop in the chat, post any questions or congratulations and comments for our winners in there. Today, I'm joined by the New South Wales Mental Health Commissioner, Catherine Lourey, and the three winners of this year's Commissioner's Community Champion Awards. Tony Hunter, the CEO of Marrin, Weejali Aboriginal Corporation, Robert Butch Young, a mental health peer worker from Southern New South Wales LHD, and Gabriel Gomes, mental health clinician at Waratah House. Thank you all for joining us today and congratulations to the winners.
Thank you.
I think this is our busiest chat, so it's wonderful that all of you were able to join us. To start us off, Catherine, can you tell us a bit about why you selected three community champions for this year?
Thanks, Asha, and hello to Butch, Tony and Gabriel. It's so exciting to have you all join us this afternoon to kind of celebrate you and your work. So why three? Normally the Commissioner Community Champion Award is to one person, but over the last 12 to 18 months, when we've seen so many impacts across the community, and we've seen so much work that people have just put into their community from so many different perspectives. And so for me, I really wanted to have awards this year that really acknowledge the strengths and the resilience and the countless efforts of many. And so when I reflected upon that, and I had met so many people, and I spoke to my team and I said, I can't just do the one nominee this year. The efforts of so many people, I really wanted to highlight across the community and across our services. So that was why three wonderful people became nominees for the award. But also I'd like to say that we did we called out to people in the community to also nominate people. So we also are having a number of people who are receiving commendations as well. I mean, you can't go through, I think, a period of such challenges to our mental health and wellbeing without understanding that efforts have been unstinting across so many different communities and organisations and services.
Yeah, it's really incredible to see the way that so many have stepped up for the good of communities and the people that they work with and for. Why in particular, Catherine, have you selected Robert, Tony and Gabriel?
Yes, well, look, in one sense it was easy, and in another sense it was always hard, because as I said, there are so many people who just demonstrated such great efforts. But for me, when I met Tony, I think in June this year, and we were invited out to Marrin Weejali, and it was just so impressive, not only to see the team, but to see Tony's leadership of that team and to see his commitment, his thoughtfulness, his empathy, but also, you know, a really determined individual who was just there for his community almost in every way. And I just think, reflecting upon that unstinting commitment, but also to provide a service that was open and welcoming. And Tony himself was very generous, and his team, in sharing their time with us for the Commission to go out and talk and have a yarn and to listen to people. And I just think that was just, again, another example of how I think Tony really exemplified what a community champion was. It was about listening, bringing people together, but also being strategic. And because I think there are a lot of good ideas that maybe go nowhere, but I think as a community champion, you really push that forward. And I think over Tony's 30 plus years has really, shown that amazing commitment. So, so congratulations, Tony.
Thank you.
And so, Gabriel, I'll do one by one. So again, Gabriel, congratulations. With Gabriel, it was really, I think, again, one of those things that we don't always see clearly, which is how our clinicians on our mental health inpatient units can also bring such strength and support and hope to those people who are going through their time in a unit, especially during COVID, when they were more disconnected from their families. There weren't, visitors. There are a whole new range of conditions and restrictions placed on an inpatient unit. And I think Gabriel really embedded that, champion, view again about working with people in their recovery journey, having empathy and compassion, and also for his broader work across the community, his commitment to mental health. And I know that people who had been patients on his unit really nominated Gabriel as someone who made a difference to them, made them feel valued and safe in their recovery. And really, when you think of all the other issues that would have been going on for Gabriel himself, working in an inpatient unit during COVID, I think it just really, for me, was really to highlight again that when we look at what a community champion is, he really embodied that. So hence why Gabriel also got an award, because, people need that support wherever they go. And over these last few months especially, their journey's been really impacted in that environment. So congratulations, Gabriel. And coming to Butch, and congratulations, Butch. Butch also has been unstinting in his work as a peer worker. And I think the commitment, not only as a peer worker, but about you're using your own lived experience for others. And I think, Butch has had so many different roles over his career, just showing where he's been able to provide that support to so many different communities and so many different people. But I think also, again, Butch was really down the front line, after the bushfires. And when you just really think about the well-being and the mental health impacts that so many people experienced at that time, and that grief and loss, especially on the South Coast, where it was not only about whether you may have lost your home, but it was about the devastation of wildlife, the beautiful forests down there. And so I just think to really understand and work with the community and to bring that lived experience into that community, to me, was just, again, just so exemplary of what a community champion really demonstrates. So again, congratulations, Butch.
Thank you.
Thank you so much, Catherine. Definitely three incredibly deserving winners. Tony, Catherine mentioned your generosity, leadership, and strategy as well, and that ability to take ideas and turn them into reality. What do you see as some of your biggest successes in the work that you've done?
I think some of the successes, we have very good trained, qualified staff. And our program at Marrin, it involves a lot of agencies from outside of Marrin, meaning that we have a lot of partnerships with a lot of services, and we run a lot of outreach days, meaning this award, I mean, I'm here speaking on behalf of this board for Marrin Weejali, but there's just so many other people that's involved, and that's including the community.
The community is obviously such a huge part of the work that you do. What are some of your hopes for that community moving forward?
Our hopes for the community, because we've got the biggest population of Aboriginal people in this local government area than anywhere else in Australia. So, meaning that there's a lot of people here. They get incarcerated through the drug ice, and the young people. But my dream is to get a Aboriginal residential substance misuse mental health treatment centres in Western Sydney. It's highly needed. We use a lot of services in Western Sydney. As I say, we've got a partnership with mental health at Blacktown and Penrith, but sometimes those facilities, in terms of our community and the client's family, they find that a bit, they find that a bit challenging. They're not very happy with, with the treatment, the way the treatment given in those facilities. But then again, we do our best. We work along with them, and we do good. We do get good outcomes from that.
Sounds like an incredible, important dream. And from what Catherine said, if anybody could make it a reality, it's you and your team. I wanted to ask Gabriel, so the Commissioner mentioned about working on a mental health unit during COVID and the challenges that you've faced with that. What have been some of your good stories that have come out of that, and times that you've seen that your work's had a really positive impact?
Oh, I see. I'm sorry, that's Gabriel. Sorry, Gabriel.
All good. Oh. All answers are valid and wonderful. We might throw it to you though, Gabriel. Yeah.
So some of the positive things that I have seen during this COVID as well, as much as COVID has brought a lot of restrictions in our life, also it has put a restriction on the life of inpatients' mental health wards, because as you know, like, people are restricted from going outside or even have a day break when sometimes they used to go out and have that break. Some of them even had a little bit of smoke leave, which actually helped them a lot. And plus the visitors, the family-based interventions or care, that was actually one of the biggest loss that we have during time of COVID. However, I think that was a good learning for us to bring patient and get them into different group activities, listen to the patient. And I think during the time of COVID, I actually came to know a lot more about patients, because of, I do thank the healthcare for giving us extra support or staff members to have some group activities for patients. And when you sit with them and listen to their stories, you get the feeling that yes, mental health or any illness is not only about biomedical model. There has to be a social model as well, integrating and working together for a recovery journey of our patients or consumers in order to get well. And I think that was eye-opening for me, and to get to know more, to get to know my patients in a holistic manner, like not only their illness, but also the social aspect, the trauma they face every day, which impacts their illness, was a great eye-opening for me. Yeah.
That sounds like some really incredible things that you can hold on to moving into the future and potentially shift some of the ways that things happen in the unit. What are some of your other sort of goals, and what do you want to see in your unit in the future and in your work more generally?
I know we always have limited resources, but to say that with the limited resources to use to maximize the use of the limited resources, that will be what I will be looking at in future. To say that reducing stigma about mental illness, and also to emphasize on trauma-informed care, because over the period of my experience working as a mental health nurse, I just realized that illness and medication just not enough, because everyone has a story, there is a trauma, and we need to acknowledge that trauma and work with the patient, not only when, or consumers when they come to the ward. That's once they are recovered, that's not the end of the journey. The journey continues in the community, and to get them proper support, cultural based care, like what Tony said, like when we have clients from Aboriginal background, to give them proper support with the proper cultural informed care will also be nice. And to look into a holistic approach of a person will be really, really good. I think the healthcare acknowledges it and they're trying their best, but sometimes in a demography like Sydney, where you have so much population is so much, it gets hard. But I do think healthcare is acknowledging it and trying their best. I hope in future it will get better.
Thank you. It's really wonderful to hear that that through thread from both of you so far, and with what you were saying, Catherine, about holistic care and community care and community leadership being so important. And Butch, from what Catherine said about you, it sounds like you really embody that holistic community approach to your peer work. What have been some of the really big successes for you in mental health peer work?
I think initially with my diagnosis of schizophrenia was getting well myself and recovering. And that was under a clinical and non-clinical recovery pathway, because eventually I had to sack my services and get on with life and own it more so. And I think the success has been able to use those skills inevitably to work very closely with individuals and that person-centered approach of what their likes and dislikes are, and get to know them better and how to express that and how to get through this cobweb of life that we have at the moment and find yourself again and move forward. And for some people that can take a lifetime, and for others it can happen a lot more quickly. And it was mentioned earlier about trauma, grief and loss, and I think the last couple of years have really raised a lot of pressure in personal lives and things like that. So recovery probably stands out the most, and having a voice, like working with people so they've got a voice and that they're heard, that not always as a group, that individual is actually heard and listened to and understood better. Because if we can do more storytelling and more individual focus, we're going to get better outcomes and get to know that person, what they actually need, and what, rather than what we want for them, is very important, I think. Yeah,
and I think that's one of the great things that peer work brings to the mental health sector, is that ability to recognize and support others to share stories.
Yeah, and it's such a wonderful story to share a journey with Tony and Gabriel today, because that's really how things like this can come to fruition, is when we all work together and we have a greater understanding of communities and individuals. I think the challenges are always going to happen. In my personal life, have always happened, and it's about how do I rise above? How do we get other people to build that self-resilience and understanding in themselves that they can actually do this? And I think COVID and the bushfires have been a great test in all of this for all of us. And I think we've actually surprised ourselves on what we can achieve and what we can do as a nation and a community. And, you know, even down to our children. Life is life, and it doesn't go to sleep. And I think that's probably the hardest part of the job too, is that you don't sleep. You do the miles, you do the Ks, and you sacrifice, but the rewards do outweigh the pain sometimes. I think to see other people thrive is what it's all about.
And looking into the future and hopefully a post COVID world, what are some of your hopes, both for the community that you serve and maybe as well for peer work?
For me personally, it's far less clinical. It's moving forward above and beyond the tradition of this 200-year cycle that keeps failing, and modernising services, and not being so dependent on medication and doctors and psychology. In fact, looking elsewhere for internal healing and spiritual healing and community connection. And I think in past we've had a better mixture than we have right now. We've got a great dependence on a cycle at the moment that demands a lot of clinical services, and I think differently to that. The work I've done, my tend is to keep people out of services, and I think I've succeeded there. And it's more person-centered than just being dependent on clinical services. That's one thing I'd like to see, is less clinical services and more focused on social emotional services. The other thing I'd like to see is, from my inpatient days, is to see this seclusion project completed. And for me, that means that there's no longer a seclusion room. And that would mean that the whole services right across the board, including corrective services and even the school system, of all take great consideration to eliminate trauma, because it's not just about the story that comes out of a hospital. It's got to be right across the board. So the violence and trauma needs to cease, in a sense, and that means a whole community conversation, not just an individual. And I truly would like to see better services and situations for my children, my neighbours, and my grandkids, that takes greater consideration for individual rights and human rights and who we really are, as opposed to a different hat that we have to work with at the moment. And it's not real all the time to have to wear that hat with so many policies and procedures and rules and regulations. I think we're better than that. I think we can show that we're better than that.
Thank you. As Catherine mentioned, the process for choosing the three of you this year was intense, and there was a lot of work that went into it. I'd love to hear from each of you, the three winners, what winning this award means for you. I'll go to you, Tony, first.
This award means so much. It means so much to me. It assures that Weejali, our board of management, our partnering agencies, staff and community, they're assured that there's a safe place that understands the shattered spirit of our community. And they understand that the programs that we've got here, they do repair the shattered spirit. And that's what Butch mentioned around trauma, grief and loss. And, once these type of people come in, like Weejali is a walk-in centre. It's in an area where there's high poverty and a lot of other issues and challenges. Our staff, they know, they understand. So basically what happens when someone walks in the door, they don't walk in here because they've got a toothache, they've got a problem with their spirit that has been shattered. And usually a lot of them come in here with an excuse of substance misuse. The referral agency sometimes, they refer them in for anger management, maybe substance misuse. But once we do that initial assessment, we identify then the real problems. And So our program is about a 16-week program. You know, we take them through stages. After so many counselling sessions, you know, with some of these people with social emotional wellbeing, mental health, then, you know, we do the K10, we do the IRA, so we do, you know, we do screening with them. And, you know, it means then it's working with them. And the people at Marrin, it's different. We got a big kitchen at the back, as Catherine knows. It's open. For some unknown reason, that people, they'll walk in here and they'll openly speak, talk about, g'day, how you going? And, you know, they're looking for something. There's three things that they're looking for in this type of people: to be needed, to be wanted, and to be loved. So basically their life through trauma and the other challenges that's going on in their life. Their families, sometimes they want them back in the house because somebody may have kicked the door in, or they may have, you know, broke a window and can't come back here. But it is those family breakdown and the trauma, as what Butch said, you know, and the people who come in and they are on medication, well, we quickly have that review. After a while, we've got our workers, they will, you know, they'll see that, they'll have a look at it. Then they'll talk to their prescribers, they talk to their family. So it's done collectively, you know, collaboratively. You know, we bring in families sometimes and sit the families around the table if people are on medication, so the family knows about the medication. But sometimes we experience a lot of young people. They come in and they don't take their medication and they may go and use other drugs. Well, you know, straight away they become psychotic. They become very, you know, very, very challenging for everyone. So we got to get them, calm them down, use with other resources we got, like Blacktown Mental Health, the acute mental health team at 7 Hills. Then we could, you know, what we could do then, we could have a look at their medication, and then we could work with them, and we sort of stabilise everything, a person. And look, we have a lot of good successes, you know, doing it and working with them, and it's really great to see. And that's what gets me out of bed every day. It gets me out of bed every day. And the hardest, most difficult thing that I've seen in this community is people got to bury their children. You know, the pain, suffering. As I said, that gets our staff and myself out of bed every day. We've got a challenge every day. When they walk in, we extend our hand, we say, "G'day, how are you? Really good to see you. You made me day. I seen you walking down the road the other day and I did wave to you. You probably never seen me." And they shake hands and straight away they'll switch on to you and they feel it. They feel that love. They feel that understanding. You know, because they've been pushed, you know, from pillar to post, haven't had the opportunity to speak about what's going on in their life in terms of trauma, grief and loss. And, you know, there's a lot of challenges, but working in our community like we do, it is also rewarding. It's so much rewarding. So our staff, our community, I always reaching out. I don't refuse any partnership agreements. We do health screening. We have health. We have men's health YANA program. We get different people to come in and different, you know, professors to come in and GPs and those sort of people. They'll come in and they'll talk to our community. Same as COVID, there was a lot of our people. They were, you know, they were hesitant in terms of, you know, getting the jab. But after we brought a couple of doctors in here, the doctor walked around, sat down in this room here, which holds about 60, 70 people, the room I'm in. I mean, it's you know, he changes people's mind. And on that day, about 70% of these people, they all had their jabs. So it's about breaking down the barriers. It's about the culture, the safety, to make them feel comfortable in a safe place. And you know, it works. It does. I was listening to Gabriel, and it was challenging, you know, in a clinical setting, and it does work sometimes. You know, some people, they need to go into that area, but if we can bring them into an environment where they feel a little bit more free and a little bit more safe, and the freedom to talk about what's going on in their life. And as you can see, the way I talk about this, I just love it. It is exciting. It is rewarding. And I've been doing it for a long time. And it's you know, good to meet you. I know why it is screening this. But I mean, I had personal experiences with it. In my life, I didn't want to live and I didn't want to die. And I went to myself all those years ago, over 30 years ago. And Weejali was operating out of a little house in Commission Cottage. Now we're in a purpose-built centre, over 22 workers, working with all, you know, different levels of government, just to make a difference. And I'm in Mount George. I love it. It's horrible one day, dreadful the next, but I love it. Yeah. I know I was not going to put this up on the screen, but I usually yeah,
I hope they do, Tony.
I think I'm forgetting what this is all about. Yeah, it's good. Thank you.
It's so wonderful to be able to listen to people who are so passionate about the work that they do, and especially about work in mental health. It's such a privilege for me to be part of these conversations, and it sounds like the award, Tony, is very, very well deserved. Gabriel, I was wondering if you could tell us what the award means to you.
I was actually, I don't know, I feel really, really humbled. I'm grateful and I'm honored as well. And it was beyond my expectation, but I really feel humbled, and also just listening and meeting with Catherine, Tony and Butch, I think I'm very much inspired. And also Tony speaks about the love that people need. I think that's love. The word love is a big healing. It's a very big healing word. And Butch talks about that project about seclusion room. I think that's also very inspiring, and I'm very much motivated, and I hope I can contribute more in coming years. But yeah, I'm grateful and humbled by the whole thing. And yeah, I'm very joyful as well.
Thank you. And Butch, how about for you? What does winning the award mean?
It just means acknowledgement for the peer workforce, acknowledgement for wellness, that anything's possible, particularly with diagnosis and lived experience, that it gives hope. It blew my mind. It was a big surprise. It wasn't expected at all. And yeah, love is probably, if I look at my own story, it's really meaningful because it wasn't necessarily a doctor or a nurse. My wellness story is really about people. It's about particular people coming into your life and you allowing them to come in at that time. So that's the difference, I think, is who are you? And maybe that's what this award's all about. It's who are you? And it's reflective of the industry we work in and the people we work with every day. It's really, it's validating. It's very important that we improve as people, as individuals. And I wasn't always a great person. So it gives leeway for that, gives inspiration to other people to want to achieve and to want to heal and to want to change. I think change equals change, and it's exciting to be part of change. And it's also exciting to have a commissioner like Catherine, who I think shocked all of us with her surprise. So as exciting it is for us, it must have been exciting for her to have that pen in her hand and go, I might just go and do this. So I think that's part of that wonderful part of working in health sometimes, is that you really embrace those small wins, because you don't get big wins all the time, but it's a wonderful thing to play a part in someone else's life that can sometimes make a difference. Yeah.
Thank you, Butch. Catherine, the Commission has a wonderful, strong focus on lived experience. What are some of the things that the mental health sector can learn from the work of the 3 community champions?
Well, Asha, we know that people across New South Wales, want their mental health and social services to be truly, people-centred, to listen and to understand them, to work with them, to support them, and to enable them to lead their own recovery and their own journey. And I think Tony, Gabriel, and Butch really exemplify that every day in their work. And I think also they are deeply connected with their communities. And I think that's the other key thing, that by doing that, you embrace the insights of those who they work with as team colleagues, as well as their clients or patients, because it is about a whole team approach, which I think, Tony was really identifying it. When we support each other and we're supporting someone through their mental health journey, it's about that listening and working together. And I just think that for me, when I look at the 3 of them and the discussion today, it just really shows that you don't, I think, but as Butch said, sometimes there are very large wins, but maybe the more important wins are the everyday wins, and the way that you can support someone in their own journey on that day-to-day basis. And sometimes you might have a bit of a setback, or the day may not go the way that you want. But I think as community champions, and I think as what people would learn, is that, you keep with it, you stick with it, because people are important and their journeys are important. So for me, it's just been able to, really, it's been a great privilege to be able to not only provide them with these awards, but really for me, it's also about giving them that recognition, and in one sense also to say thank you to each of them for their work. And I know sometimes you can just get up and go to work every day, but I think the 3 of them really just bring their heart and soul into that work as well. So I just want to say thank you as well.
Thank you, Commissioner. Thank you all so much for chatting with us today and sharing your stories and expertise and insight. And it's been wonderful. Congratulations again to the 3 winners. What a great chat. It's been so wonderful chatting with you. Thank you all. Don't forget, everyone, you can learn more about the awards, the finalists and the winners at mentalhealthmonth.org.au. Thank you so much for tuning in to this year's series of conversations with all our award winners. It's been such a joy and privilege to learn about the extraordinary work that's being done in mental health. You can watch any of the videos that you've missed out on or that you want to rewatch through our Facebook or the Mental Health Month website. Stay tuned to Way Ahead for upcoming events, including Perinatal Mental Health Awareness Week and programs. Thank you. Have a wonderful day.